Hi, this is MMRT TV. Today we have a guest from King County Clinic, Dr. Claudia. She's going to talk about the free clinic they're going to offer on October 26, 29 until 29, 2017.
Hi, thanks very much for having me. I am really happy to say that this is the fourth year that we'll be having the Seattle King County Clinic. It's for 4 days, as you said, from the 26th to the 29th of October. And the great things about it is that it's completely free and completely open to everyone. We require no documentation of any sort, and it is also a sensitive area for the immigration people will not be permitted inside the KeyArena. The clinic opens its doors at 6:30 every morning, but we begin to give tickets, first come, first serve, for admission into the clinic at 5 in the morning. So because in the past years, people have started to line up very early, and in October, it's kind of dark and cold, we opened the Fisher Pavilion at 12:30 midnight, a little after midnight. And in the Fisher Pavilion, it's warm, there are chairs and lights, and people can wait in there until the ticket distribution begins at 5 a.m.
So what kind of medical services do you offer?
So 3 big services.
Okay.
The vision services are fantastic. You can come and have a full eye exam, and they will make glasses for you free.
Wow.
That you can pick up in early December or have mailed to you. If you have a prescription that is less than 1 year old, you can just bring the prescription and they'll make the glasses free. So the vision section is one big section. The dental section is fantastic. The whole floor of the KeyArena becomes a dental office, and there are rows of dentists and hygienists. They do deep cleaning, they do extraction, and there's a 3D printer that prints crowns. So very fantastic, very thorough dental work. And then the medical services are huge variety of offerings. You can have a mammogram, a pap smear, HIV or hepatitis testing. There are immunizations. You can have a routine medical exam. We have physical therapy, chiropractors, naturopaths, and very important, there are social workers who will be there that are able to connect you with resources in the community that are low cost or no cost also. So huge variety.
This is wonderful, especially for low income and refugee and immigrant, especially people who suffer or newcomers who they don't have medical insurance. This is a really fantastic service for the community. And may I ask you, who sponsors this kind of events?
Sure, it's absolutely wonderful. And let me just say that since you said a lot of refugees and immigrants, we have interpreters, so you don't need to speak English to come to the clinic. We have both live interpreters and interpretation through the computer, so don't let language be a barrier. The Seattle Center Foundation is the main sponsor. They give us the KeyArena for 4 days, which is not a small donation, and then there are smaller partners who also provide lab services, who provide supplies. So for example, Kaiser, King County Public Health, there are a lot of smaller organizations that also donate. But the backbone is really all of the volunteers. Everyone from the person checking you in to the dentist, the doctors, the radiologist, everyone is a volunteer.
Yeah, I'm wondering, the nurses, the doctors, medical technicians, from what clinics, from what medical facilities are coming to volunteer?
So they're coming from everywhere, and what's great is the shared characteristic of everybody who volunteers at that clinic is that they have huge compassion and want to help. We all understand that the system is not one that is favoring the people who need it the most right now. And so everybody there comes with a good heart and a big desire to help. So they come from Swedish, they come from UW, they come from Group Health, which is now Kaiser, but they come from everywhere, and really are in it for the right reasons.
Well, this is really good resource. I'm wondering if you can do it, like in our communities, in our churches, community centers, ethnic-based community centers, we try to have medical fair every year. So is there any way you guys can collaborate with us to do this kind of services to the community?
That's a great question, and I think the joy would be to not need to have this clinic every year, so that each community would have adequate resources. And I think it would be great to be in contact with the organizers to see what kind of outreach can happen. I know that the students at the UW in the School of Medicine and School of Nursing often put on the health fairs. And it would be really nice to see a more robust structure so that we come to you. You don't need to come to us.
That's wonderful. Years back, the days, we used to partner with Seattle U, School of Nursing. So we have programs, like in public housing. So they used to come and do health fair and also come to senior lunch, whenever we have events like Juneteenth, which draws a lot of people. So they used to come and do blood check, blood pressure check, blood glucose and stuff like that. And this is very helpful to the community. Yeah.
It's hugely helpful, and I think it's a great idea to begin to activate that again.
Yeah.
Absolutely. Good point. But until this happens, at least there is this big, wonderful resource. So October 26th to 29th, we'd love to see everybody there. Everyone's welcome.
At Seattle Center, right?
At Seattle Center.
All right. So this event, medical event, we're going to have like vision, dental, and medical exams for free. So we invited the community to come take advantage of this great resource.
Yes, and in any one day, people can receive two services. So you can either receive vision and medical or dental and medical in one day. You may try to come back another day also, but again, you have to wait for the tickets. And medical refers, so there's vision, dental, medical. Medical, you could receive multiple of the medical services. So if you see acupuncture, you can still have a physical exam and you can still see a social worker. That's the whole variety, the whole menu.
So I'm wondering, if the doctors there or medical professionals prescribe medication and stuff, do they provide medication at that point?
That's a really great question. All of the doctors have the list of, at the pharmacies, which drugs cost $4 for a month.
Okay.
So we prescribe medications. The exceptions are we give no opiates.
Okay.
And no medical marijuana. But other than that, we are delighted to provide prescriptions. And we want to tell people, please, we have lab services available, but you do not need to fast. It's a very long day, and so we want you to eat before you come and bring some snacks.
Yeah, and people, since they come like 5 in the morning, and it's October, the weather is changing right now, so people need to bundle up.
Bundle up, bring snacks, make sure you do eat, and make sure you take your medicine before coming
or bring it with you.
Or bring it with you, exactly.
All right. Yeah, if people want information about this resource or this healthcare day, when they can get the information, where they can visit?
Sure. So there's a website with a lot of frequently asked questions. You can go to seattlecenter.org/patients, or you can call 206-684-7200.
Great.
Thank you.
Well, I'm so proud to live in the Northwest, especially Seattle, and this is a really, really fantastic service for the community, and we try to get the word out so people can take advantage of that, and I really appreciate what you're doing for the community, and really, really, really appreciate it. Thank you so much.
Thank you very much. It's a pleasure.